Hello, lovely people. Today is a follow-up episode to my previous episode on mold-related illness. Today I want to focus on the treatments and how to actually recover, but this is going to be a quick fire. I will not be giving specific details or a step-by-step guide because this really does need to be tailored to the individual, which mold and mycotoxins they're exposed to, and how that has manifested in symptoms. Again, mold-related illness is called the great mimicker, meaning it can show up with a ton of different symptoms that affect a lot of different body systems, and no one exposure can look the same. And so with that in mind, you really need to have all of these other conditions that it may look like ruled out, and you need to have mold ruled in. And so if you guys didn't watch that episode, if you are just coming to my channel now, please go back and watch a couple episodes again where I discuss how to get diagnosed and the symptoms associated with mold-related illness. But today we're going to focus on an overarching theme of how to treat mold, the broad overview, if you may. So again, not allowed to give specific dosages, but this should help you get a really clear idea as to how to actually heal, what to think about, how to look at this as a holistic picture and not just a simple solution, because it really isn't a simple solution, unfortunately. So ultimately, you do need to work with a qualified doctor who knows what they're doing in regard to mold-related illness, because the recovery can be long. It can be longer than you want it to be. It can be a bumpy road. Rarely is it just a linear upshot of improvements. But if you know what you're doing and you're working with someone who is also well-versed in this, it can very much be something that is solved. So let me just quickly introduce myself. My name is Robin Lewis. I am a naturopathic doctor practicing in Vancouver, British Columbia, Canada, and let's jump into it. So the first and most obvious thing to think about are the antifungal therapies. So mold is a type of fungi, so I'm going to use those words interchangeably, but there are specific therapies that go after the mold itself. Now, the first thing I'll talk about are the prescription grade therapies. These are the ones that you are going to need a doctor for because they're prescribed. Some of the prescription grade therapies that I'm used to seeing in the context of mold-related illness are things like nystatin, itraconazole, ketoconazole, amphotericin. A lot of these can be oral rinses or nasal sprays, but many of them work by binding to the sterols in the cell membrane of that organism. So essentially what they'll do is they'll disrupt that sterol that is supposed to be a part of the cell membrane, which essentially causes it to fall apart, and then the organism cannot grow anymore. So that's the loose mechanism of most of these therapies. They just kind of do it from different angles, slightly different medications that can work in slight different ways, but essentially all are going after the cell membrane. And as I just said, a lot of these will come as nasal sprays, for example. And this is actually really helpful because if you go back to my previous video, you will understand that the mold loves to live in our sinuses, our nasal passages, our upper respiratory tract. And so that's why it gives a lot of symptoms in those areas like sinusitis, allergic-like symptoms like running nose, congestion, things like that. So having it as a nasal spray is actually a benefit, but it's not the only form being used. Now, there is one thing that I should briefly warn you guys about when you start any of these antifungals. So after this, I'm going to talk about some of the herbal options, but regardless of which antifungal you're using, there is a high potential for what we call a Herx reaction or a die-off reaction. They're used interchangeably. So essentially what this means is usually in the very beginning of treatment, as these things are dying in high numbers, they will release their inflammatory proteins and compounds as they die. Now, if they're released in very high numbers, they can make you feel sick on their way out. And again, it's usually in the very beginning for the first 3 or 4 days, and it can be very uncomfortable. It's often described as like flu-like symptoms, so you can get gastric upset, body aches, headaches, fatigue. Now, again, this is why you want to work with a doctor who knows what they're doing, because it can feel like you're reacting poorly to the medication. And of course, that is a possibility, but it is also kind of to be expected that you will have some level of die-off reaction, because that's just how they work. As they die, they release a lot of their inflammatory compounds that can circulate before they get eliminated through places like your bile and your bowels. And that's really where these other supportive therapies really help. So for example, making sure detoxification is really supported during this process so that you can efficiently eliminate those things and hopefully be less symptomatic. So again, these are the supportive therapies that are very important in the context of treatment, but aren't as obvious, right? It's not directly targeting the organism, but it's helping your body eliminate the organism and have less collateral damage as they are leaving the body. And so let's talk a little bit about the herbal options, because these are wonderful options as well, and they come in many forms as well. So let's start by talking about some of these herbs that are high in volatile oils. So there's things like oregano, thyme, boswellia, and oftentimes it's actually the oils within these plants that we try and distill and concentrate into what we call volatile oils and use that as therapy. Now, it's very important to note that you cannot ingest, you cannot swallow essential oils. These volatile oils, essential oils, whatever you want to call them, are not for oral consumption, but they can be inhaled. So similar to the last medications where you'll get a nasal spray of it, you can have an inhalation of these things, which can have an effect on the sinuses. But another really interesting thing that you can use those oils for is for the home. So it's helpful for internal mold organisms as well as the mold in the home. So Dr. Jill Krista, who is one of my favorite naturopathic doctors who works in the mold world almost exclusively, she talks a lot about this. And also go check her out. She's amazing. But it's very interesting that the same therapies that I can inhale to help with some of the colonized areas in my sinuses would also be helpful for cleaning agents throughout the home, cleaning the air, cleaning the surfaces, things like that. Now, of course, it's not just the volatile oils that can be useful. Other herbs like allicin, aka garlic, pau d'arco, tulsi or holy basil, myrrh, a lot of these herbs can also be used in the form of like capsules, tinctures, teas, and things like that. It's not just the volatile oils. And in fact, even some of those herbs I mentioned before, like thyme, can be made into these formulations as well. You just don't want to orally ingest the volatile oils. Now, this would be helpful for more of a systemic effect. But of course, it does need to be concentrated in a fairly high amount to have that killing effect. So it's not going to be as simple as just add some garlic to your dishes, add some thyme. It's not going to be enough to really kill off those bugs. And depending on which you have, you might choose different herbs. You might choose different prescriptions that target that type of mold better than another type of mold. So as you can see, this is nuanced. And a lot of the times, also worth noting, they'll mix and match these things to confuse the organisms, because these bugs or fungi, or whatever you want to call them, are very resistant to treatment. There is a reason they have been able to stay in your system for so long. So you have to get creative when killing these things, and often mixing therapies can be really helpful in that context. So that's just to give you a loose idea of some of the antifungal therapies that could be used. Are they the only ones? No, there's other things like ozone therapy, certain nutritional things that your doctor may implement to help target the mold itself. But the idea is there will be something in that treatment plan, or there should be, that does go after the mold itself. Now, the next very important component of this is giving something to address the biofilm that these fungi will form. Now, you see this a lot with organisms that have really solidified their presence inside the body. They'll form what is considered kind of like a mesh network around themselves that help hold the colony together and protect and hide them from your circulating immune system. And roughly speaking, the longer it's been there, the more advanced that biofilm may be. So again, this is why a lot of these things become chronic issues, is because even in a healthy person who's not immunocompromised, if the biofilm is strong enough, your immune system won't really be able to access them, to get rid of them, and do the job on its own. So giving something to break up the biofilm is very important. And there are actually considered different stages of the biofilm, again, depending on how long it's been there. So that might be something that your doctor is considering. Which biofilm busting agent am I going to use? How long has this been going on? How strong do I think that biofilm is? And things like that. So to give you an idea of some things that can be used in the context of breaking up that biofilm, there's things like xylitol, NAC, we have EDTA and DMSA, which are chelating agents, so they address the heavy metal components of some of these biofilms. We have bismuth, which is another more prescriptive grade thing, stevia, tannins, ALA, glutathione. The list does go on and on. There are lots of great therapies that can be used. And depending how big and strong we think that biofilm is, we may choose different therapies. If you have a heavy metal exposure in your past, we may choose those chelators. There's lots of new ones here, as always, and just keep that in mind. But there should always be something in there to help address the biofilm in addition to addressing the mold more directly. Because what is the point in taking all these really strong antifungals if they can't penetrate and actually access those colonies? So that is very important to consider. And if you're working with someone who hasn't talked about that yet, big red flag. Okay, and now the last huge component of a really good mold protocol are binders. So essentially what this is referring to are agents that are used to bind the mycotoxins in the gut as they're being eliminated. So just as a brief refresher, mycotoxins are the toxins that these mold release that make us very, very ill. And essentially what they'll do is when your body's trying to naturally remove these mycotoxins, they will do so through the bile. So the bile will have the mycotoxins within it, and then it'll get excreted into the digestive tract and hopefully eliminated through your stool. But because it's a part of bile, what happens with bile naturally is it gets dumped into the upper part of your digestive tract, and then later on, it does get reabsorbed. I believe it's like 95% of that bile gets reabsorbed for recycling. Your body doesn't make tons of new bile every single day. Most of it is recycled. So we obviously do not want the mycotoxins to come back in with the bile. So that is the purpose of these binders, is to kind of detach this mycotoxin from the bile so it doesn't have a chance to go back into circulation. A couple examples of binders could be as simple as something like insoluble fiber. Sometimes you'll see charcoal used, activated charcoal, different types of clay, chlorella, glucomannan, humic acid, and some types of lactobacillus probiotics. Again, is this a comprehensive list? Probably not. Those are the ones that I'm used to using in my clinical practice. And with binders, there is a big caution as well, and that is that they could be potentially constipating. So it is extremely important during this process that you're staying well hydrated. And if you are being constipated, you need to halt, because constipation is one of the worst things during this process. If we are not eliminating through the bowels, aka we're not having our bowel movements every day, then those toxins will get reabsorbed. The longer it sits in the digestive tract, the longer it has an opportunity to get reabsorbed back into circulation, again, making all of your efforts completely useless. So you really want to make sure you're not constipated during this process. The binders can do that. So this is where you might have to adjust some of the dosages, make sure you're really paying attention to your hydration and things like that. So just a little caution around binders in that regard. And again, depending on which mold and which mycotoxins that you tested positive for, you will choose different binders that have more of an affinity for that type of mycotoxin. So then I will briefly jump into some of the supportive therapies, but honestly, it depends on how it's affected you as an individual. What kind of collateral damage had an opportunity to present itself? But there is usually always some element of diet, immune support, and detox support. Those are kind of always there, but then there may be additional therapies depending on how that mold has affected you as an individual. If we talk briefly about mold, we are referring to the foods that contain a high amount of mycotoxins, because food is definitely a exposure. It's usually not the thing that makes you drastically ill, but it's not going to be very helpful if you're constantly still taking in a bunch of mycotoxins as you're trying to get rid of them. The idea is to reduce the burden so that your body can focus on what's already within the body and not all of these incoming new sources of mycotoxins. So to give you an idea of some of those mold-related foods, we're looking at things like a lot of grains, honestly, are notorious for having high mycotoxins. A lot of different coffees, although there are really good high-quality coffees you can get to avoid this. Fermented foods, as it ferments, it tends to attract a lot of mold and therefore mycotoxins. Vinegars can be on there. Peanuts can be on there. There's a large list. And again, if you want to check this out, Dr. Jill Krista has great resources on her website. There are a lot of good resources out there that will identify those specific foods, but that would be a very helpful component to this overarching protocol to get mold out of the body. If you want to learn a little bit more about detox, especially in more detail, I did do a whole video on the importance of detoxification and what it looks like to support detoxification. But loosely speaking, it could also involve a little bit of a diet. It can be lifestyle things like dry brushing, and saunas are very good at helping us sweat it out through the pores, move our lymphatics. There can be herbs that are very helpful. So things like milk thistle, licorice root, turmeric, artichoke. There's a lot of great herbs that support detoxification. But the point is, should be some level of support in that area as well. So go check out my last video on detoxification if you want to learn a little bit more about that. And then immune support can look like a lot of different things as well. So I wanted to keep it fairly brief and broad because I wanted to help you understand what to look for in a good mold protocol, because the recovery is long-winded. As I mentioned before, it can take months to get on the other side of this. And then once you get on the other side of it, we want to make sure you stay well. So it's not just about getting the mold out, it's about cleaning up all the collateral damage that the mold created in the process and helping you thrive moving forward. So I hope you found today's episode helpful. Aside from specific dosages, which I really cannot answer online, if you have any questions about the theories, the ideas, things like that, please comment them below. I hope you found this helpful, and thank you again for taking the time to listen to one of my videos.